Pet Cancer Awareness Month. That's next on All for Animals.
The most common forms of cancer we see in cats and dogs is lymphoma, but then there are a lot of other ones behind that. Mast cell tumors, soft tissue sarcomas, nasal tumors, hemangiosarcomas are very common in dogs. In cats, they get fibrosarcomas, oral squamous cell carcinoma, and they also get mast cell tumors and other skin tumors as well.
Are there certain symptoms for certain kinds of cancer?
Yes, it often depends on where the tumor is located or where the original cancer is located, and it very much depends on the type of tumor as well. Many times the cancer can just be a lump or bump that you find on your pet, but oftentimes there are other things going on. For example, for oral tumors, they might have a foul odor from their mouth, or they might have some blood coming from their mouth, or they might have difficulty eating or pain when eating.
And what about skin cancer, for example?
Skin cancer is fairly common in dogs, probably because it's easier to diagnose because it's right there on the surface. Usually it'll show up as some kind of lump or bump. You have to be very cautious because many dogs, especially older dogs and some cats, will get lipomas that are benign, but many other types of cancers can look like those lipomas. So you want to make sure to get them checked out and get into your vet if you notice any abnormal lumps or bumps on your pet.
Or a wound that's not healing?
Another sign, there are a number of different indicators for cancer, things like bleeding from certain areas, wounds that don't heal, or ulcerations of the skin that don't heal, and those can often be signs of an underlying tumor or cancer.
So in people, when somebody is diagnosed with cancer, we think chemo, radiation, surgery. How is it different, or is it different for pets?
In many ways, it's very similar. We use the same three basic modalities. So surgery and radiation are used mostly to treat the localized tumor or the primary tumor. And chemotherapy is often used to treat whole body cancer. So cancer when it's spread, or our most common cancer, lymphoma, is treated with chemotherapy. We do use other therapies as well, like immunotherapies and small molecular inhibitors, but they're just starting to take off in veterinary medicine, whereas they're a lot more common in human medicine.
And so how is treatment administered in a way that is different from people, or is it?
It's different in a number of ways. First of all, the way we administer it, especially for radiation, they do need to be under anesthesia or a heavy sedation because we have to leave the room and we can't tell them to sit still and don't move. For chemotherapy, a lot of times it's done just by holding the animal with a lot of TLC. We just keep them calm, try to pet them. The other thing that's very different from how cancer is treated in people are our goals of treatment or how aggressive we are. A lot of our chemotherapy regimens, they're designed to provide a good quality of life, not necessarily going for cure. And same thing with radiation. For example, in people, if you get radiation for a primary tumor, you might get 7 or 8 weeks of radiation. But we can't anesthetize an animal for that many days in a row. It's a lot. So we usually do something in between, closer to sometimes 20 to 25 treatments, depending on the type of tumor and the location.
What about side effects? With people, you have chemo, you have hair loss. How about with pets?
The hair loss is very breed dependent, so there's some breeds who will go pretty bald. They don't seem to care about it though, so we don't worry too much about it. The bigger, more important ones are things like intestinal upset, so vomiting, diarrhea, nausea, weight loss, loss of appetite, and then also bone marrow suppression. But most of the time, these patients are getting checked fairly regularly to see what their white blood cell counts and what their platelet counts and red cell counts look like. So we make sure that we're staying on top of those things so they don't get very sick from it.
Right, and with people, we hear about nausea and all that, and there's medication that you get for that. So is there treatment for pets for those side effects?
Absolutely. There's many treatments that we can use for nausea, for vomiting, for diarrhea, and for any of the symptoms that we have. There are a number of different treatment options that we have to try to manage those. Doesn't mean your pet's going to be totally symptom-free during chemotherapy, but we can try to keep them as comfortable as possible.
I rushed Sydney into emergency with a full-on nosebleed, so that was an obvious symptom. Tell us about the kind of cancer that she was diagnosed with.
So Sydney had a nasal tumor, a nasal carcinoma, and those are fairly common in cats. So we do see them a lot of times. They fill up their whole nose, and it makes it hard for them to breathe. Or like Sydney, they'll have bleeding, and that's why you'll identify it. Sometimes they'll actually get a swelling on their nose. So any lumps or bumps or any changes in their eye conformation, you'd want to get them checked out, and it could be a sign of a nasal tumor.
So how was she treated?
So Sydney was treated with a definitive course of radiation. We did 20 treatments, and they were given every day, Monday through Friday. She did get a mild anesthesia for each one of those treatments. Cats tend to tolerate that very well. And also the side effects that happen during radiation therapy, cats do very well with. They usually don't have a lot of severe side effects like you would see in dogs and especially in people.
So Sydney did not need chemotherapy. Now, I'm assuming that's because the cancer had not spread. Her lymph nodes were clear. She was a 3-year-old cat that was otherwise completely healthy. And so am I correct in that assumption about the chemo?
Yeah, every patient who has cancer will always make a full assessment of them to look for spread of cancer. It's called staging. In Sydney's case, I believe we did a whole body CT scan to look everywhere. And in cases where the cancer has spread or whole body cancers like lymphoma, chemotherapy is indicated. When a tumor is localized, usually it's surgery that we use to try to treat it. But unfortunately, the nasal cavity in cats and dogs, surgery is not very helpful just because it's a very tricky area and we pretty much never get the tumor out with surgery alone. And so radiation therapy becomes the primary treatment for those tumors.
So Sydney has been in remission for 2 years. Yay! But I do bring her to the vet every 3 months for a checkup. So when I bring her in, what are you looking for?
So after treatment for a nasal tumor, what I'm looking for are some of the side effects, and we have a cataract now, which is manageable, but also other potential side effects like damage to the bone, or radiation can actually cause cancer, so we look out for other tumors. But more importantly, I'm looking to see if the cancer is growing back, and hopefully at this point it's not going to. But look for signs like congestion in the nose, swellings on the face. I want to make sure that her eyes are where they normally would look like they should be, because those all might be signs of the tumor growing back.
What's the thing you do with the slide?
So every time one of my nasal tumor patients comes in, what I'll do is I'll just take a plain glass slide and hold it in front of their nose, and if the slide fogs up, it tells me that they're breathing well through their nose. And it's not a great tool, but it's a very good tool to tell me at least how much air they're passing through there. If they had a tumor, that would probably start to decrease over time, and we would want to investigate further.
As a veterinarian, how do you advise patients about treatment or even whether or not to treat?
That's a huge part of what we do, actually. My goal as a veterinary oncologist is to give you all of the information that you need to make the best decision for your pet, because it is a very personal decision whether or not you'd want to actually do cancer therapy for your pet. So my goal is to try to let you know the treatment options that we'd potentially recommend, and there's usually a bunch of different options, the potential side effects that might arise, and the potential benefits of treatment. You know, how long we expect it to help, how long we expect it to keep the tumor under control. The other side of my job as your oncologist is to make sure that your pet's comfortable. So if the cancer is not really treatable, or if it's in an area where treatment's going to be too dangerous, we'll talk about palliative measures, things that are used to keep them more comfortable and try to prevent pain and discomfort down the road.
I think that's also important to note, is that comfort care can also be an option. I think some people are afraid, oh, my animal was diagnosed with cancer, I have to put them to sleep, like right immediately. And that may not be the case, correct?
Yeah, I do have people come in to see me once in a while, and they do say that. They said, oh, so should we put them to sleep right now? And I say, well, is he having a good time? Is he eating? Does he like to do this? Does he like to run, go for walks, jump up on the bed? And if all those things are happening, or even if some of those things are happening, it doesn't necessarily mean that they need to be put to sleep. Maybe they're going to have some good quality time. And there are pain medications that we can use. Palliative radiation can help with pain in certain locations and certain tumors. We can treat infections if they have secondary infections, to try to keep them comfortable and allow them to get some good quality time.
Cancer treatment in pets is expensive. It just is. And it's like having a child without health insurance, frankly. which is why I'm an evangelist for pet insurance. I really am. But not everyone can afford it, and we know that. There are some organizations that can help people, and I know that Blue Pearl is affiliated with one. Tell us about that.
Yes, well, we have Frankie's Friends, which is a fund that's set up. It's a non-for-profit organization separate from Blue Pearl, but we work closely together. And they collect donations, try to raise money to help pets with all kinds of diseases, but especially with cancer, who typically aim towards pets who have a pretty good prognosis and owners who just can't afford the treatment. You do have to apply for it and show need, but there are a number of patients who are helped out by it every year.
For more information about Blue Pearl, visit BluePearlVet.com. And remember, if you're thinking about getting a pet, please make yours the next great rescue story and head to a shelter near you. I'm Susan Richard. Thank you so much for watching, and we'll see you next time on All for Animals.